try to understand what are the challenges faced by working women in our society. As we know that women play many different roles as a mother, as a wife, then they go to job and they will be taking care of the elderly people in the family as well. So during all this time, what happens is even the women's body is undergoing so many rapid changes in a month. So a lot of hormonal changes happen in a woman's body, which can lead to a lot of emotional conflicts in them and a lot of mood changes. So it's always better that the woman and the family around identifies these symptoms or the issues that the woman is facing and which can be addressed at the right time. So let us say from the time of menarche till the time there can be infertility problems in the woman, when the woman becomes pregnant, then postpartum, then our postmenopausal, and in between the menstrual cycles also what we have is premenstrual dysphoria. So these are all the hormonal changes in the phases of life that a woman passes through, which poses a lot of challenges to them. So premenstrual dysphoria is a syndrome wherein a week prior to the onset of menstrual cycle, onset of periods, she experiences a lot of irritation, mood fluctuations, lot of anxiety symptoms, sleep disturbances. So definitely some of the women experience through all this. The severity can be mild to severe. So the treatment also is based upon the severity. Firstly, the woman has to identify that she is going through such a phase through a cycle so that the days or the onset of the symptoms can be addressed properly. So after identification, the family members also should be supportive to her, especially the spouse who does not misunderstand her mood changes but tries to support her emotionally. Proper diet, having a lot of fresh vegetables, fruits and plenty of fluids during this time also reduces the symptoms a lot. And proper sleep is also important, and reducing caffeine and other alcohol like beverages. Also, women is encouraged to practice some yoga exercises, proper postures maintaining, so that the symptoms can be reduced. And talking to a friend, talking to a family member is quite helpful during this phase when she is undergoing a lot of emotional turmoil. Let us say, even after practicing all these lifestyle changes, the symptoms are not reduced. She's still suffering, and slowly these symptoms, when they pass on into depressive symptoms like a lot of low energy, a loss of interest in activities, a lot of hopeless ideas or guilt feelings and sleep disturbances which are more than 2 weeks period of time, we term it as a depressive disorder. So when the severity of any of these symptoms are increasing, it is better that a professional is consulted, and the woman can be benefited by cognitive behavior therapy or, if required, medications. Another significant life event of a woman, motherhood. So when a woman gets pregnant, these days we see a lot of infertility treatments which the woman has to take for conception, which involve a lot of hormonal injections and tablets, which also can have a mental toll on her. So it becomes important for practicing proper regimes and also proper meditation. And like I said earlier, blaming a woman for not conceiving or blaming a woman for not being able to balance the work and family properly should be stopped. And she also has to come out and talk to her doctor or talk to her friends about it if she's experiencing a lot of symptoms. After pregnancy, these days we are seeing that there are many employee benefits as well. There are many colleagues who are also supportive, but it becomes essential for the awareness to increase further so that many women are benefited from this. Then postpartum, after delivering the child, what we call as the postpartum blues, which is only for a few weeks and it subsides with the mood changes and the irritation that she's experiencing. But let us say the duration is for more than a month and still she feels very low. She feels very helpless. She doesn't have interest in taking care of the baby, and there are a lot of crying spells. then definitely proper treatment has to be taken so that the mother doesn't slide into depression. So a depressed mother, a sad mother might not be able to take proper care of the baby, so which again will have an impact on the emotional growth of the child as well. So it becomes very important for us as a society and all the family members to support her, because the least that we can do is talk to the woman and reduce her emotional distress rather than amplifying it, rather than blaming her for the situations that she is in. A happy mother, healthy mother is very important for the growth of our next generation.